All right. So I hope that was helpful. I hope you got some success out of it. Now we're going to proceed to a slightly different area. We're going to be doing the same thing, but with the mandible. So let's get started. Let's go back to our image and let's hit reset. So everything's reset. Reset everything. Good. Now let's focus on the mandible. So first things first, we want to go to the scout view and limit our field of view to just the mandible. So let's go to the mandible. Again, show a bit of your opposing dentition. This blue line, which is your axial line, let's move that blue line to the mandible so we have a good idea of what it looks like. There you go. Okay, done. Now, obviously, the maxillary arch is different than the mandibular arch, so we need to redraw a new arch. So let's do the same thing again. Go to the arch button, click on that, and start afresh. 1, 2, 3, 4, 5, 7, 8, 9, and double click 10. All right, so now we have the arch form. Again, you'll notice it's got the maxilla and the mandible, but we don't want to see the maxilla, so let's limit our field of view. So let's go to the scout button, click on the scout, let's drop our field of view, and okay, so we only see the mandible and maybe just a little bit of the opposing clinical crown there. All right, so now we see just a little bit of the opposing clinical crown. Okay, but you're going, I'm having a hard time seeing the nerve here. Not a problem. What first thing we're going to do with mandibles is you always trace out the nerve. And so the way you would do it is, watch this. If I grab in the panoramic view, if I grab this scroll tab and I scroll it up and down, look at the axial view. Do you see the blue line moving in and out? So you are going to use this to help track your nerve. Okay. Also look at the cross-sectional view. It's also moving. So you and I know that the mental foramen usually come out at where the first and second bicuspids are. So let's move the sectional slice to where the first and second bicuspids are. So let's go over here, grab this, and let's move it to, let's say, the second bicuspid, second bicuspid. All right, there. All right, and here you can actually see that here's the mental foramen. All right. And then now, by moving the panoramic back and forth, you can track the nerve quite nicely. All right, so let's start. I always start off with the mental foramen right here. All right, now we're going to click the nerve button. Where's the nerve button? There it is, nerve. And then once you've toggled it, start drawing. You just click once, click, click, and then I can now enlarge this image. And I'm playing with the slices. There it is. Click, 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 click. And again, if you're going to err, I would suggest you err in the superior portion of the nerve, because and when you're done, just double click. And the reason I say that is because it gives you a little room of error. If you're going to err on the safe side. Okay, so now after you've double clicked it, you basically have tracked out your nerve, but then doesn't really look very obvious. So let's increase the thickness of this. Boom. And now you can see that nerve very clearly. At this point, you can go back to the 3-6 site, or the first molar site. Okay. And ideally, you want to start measuring. But before you do so, a few things we got to do. We got to orient this sectional slice to be in parallel to the adjacent bicuspid. Now you'll notice I didn't say parallel to the molar, simply because the molar has drifted forward, and so the clinical crown has tipped forward, and so you can't really rely on that because it's misleading. what you would probably want to do with that tipped crown is perform some some enamelplasty or recontouring of that crown so that you have a more flat surface and you don't have that big of a black space triangle at the embrasure space for food trapping. So let's orient that sectional slice. So I'm just going to orient it. There you go. That's quite parallel to the bicuspid. Okay. And I'm just going to see, am I relatively happy? Yeah, I'm relatively happy with that site. Okay, now before I do my measurements, you can see this red dot represents the nerve. I want to move my axial blue line. This is what I called factoring in your safety. And you want to put your axial blue line not right on the nerve, because that's just plain silly. And you want to just move it approximately 2 millimeters away from that nerve. And then that is your safety. So you're moving at approximately 1 to 2 millimeters away from that nerve. Okay. Now you can see that's your functional cusp tip. That's your palatal cusp. This is the lingual fossa. This is the buccal incline. This is the tongue would be on this side. The cheek would be on this side. And now you can do your measurement. So same thing. Yeah, I'm going to do my measuring button. Measure, click, find a ruler, toggle the ruler down. Now remember, this is the functional cusp tip. And I want to be pointing or facing the functional cusp tip where possible. So I'm going to go from here. I'm going to measure from the tip all the way to the blue line. And that says I've got about 14.8 millimeters. Now, I am also going to measure my width. I'm going to measure from here to here. Click once and click here. That's 6.6. Okay, and I'm going to go another one mid, somewhere in the middle, from here to here. And that's 8.79. Okay, let's move these tabs around. Let's turn off the measuring button. Move this over so I can see that. Move this over. Move this over. All right. Now, let's also measure the distance between this blue line and the nerve. I'm just curious. So here's the nerve. And then here's your blue line. And about 1.97. That's close. That's about 2 millimeters. Okay? So that's what I meant by factoring it in. Now, at this point, you're actually ready to take a picture. So I want you to take a picture of this. Go ahead, click here. Let's call this 3/6 sectional. Boom. And then you also want a panoramic. Click this. 3/6 panoramic. Panoramic. Done. Okay. That's it. Once you've done that, that's your treatment planning for your lower 6. Now, a few things you need to be aware of. This measurement, as nice as it is, it's not actually complete, because if you look at this superior part, the crystal part of this sectional slice, by the time you do the osteotomy, a good chunk of this, sharper ridge and will actually be obliterated through the osteotomy, which means the platform, the very top part of the implant, will likely sit near where the 6.67 line is. Okay, so this is where you get to play with virtual implants. All right, so this is a 3/6, so this is a molar. So ideally, you want to have a diameter of about 4.5 for a molar. And so let's choose a 4.5. So let's go to implant, click on the implant button, hit place, and then you go to your site and you just click on where it's going to be. And it's going to ask you, what tooth is it? Well, it's a mandible. So go click mandible and hit number 3/6. Hit OK. Boom. All right. Now, again, we have to orient the implant. Remember, this is in 3D space. All right. So on the panoramic, it looks quite nice. But on the sectional slice, it's completely out of whack. So let's enlarge this one. Now, I want you to watch the cursor. Watch my cursor. Right now, it's a crosshair. But as I move it toward the actual axis of the implant, watch what happens. It turns into a spiral. And that spiral now allows me to change the orientation or the angulation of that implant. All right. Same thing with if I move it over, if again, not pressing the button, if I move it over the implant body, it'll turn into a white cross. And once it turns into a white cross, you can actually move this implant. So you can actually click on the body and you can actually move it around. Okay. And so here I am. I'm trying to point it toward the functional cusp tip. And this is a 5x10. The default is a 5x10. But let's say if you wanted to change it, you simply hover your cursor over it until it turns into a white cross, white arrow, right-click it, and go Implant Properties. And you can change this to a maybe 5, maybe even to a 4.5 and you can change it to 11.5. There you go. Okay, there you go. And then now you can change the pitch. Again, you're waiting for that little swirl of a cursor. Or you can actually wait until you have the white cross and then you can actually move it around. All right? Now, in addition to measuring the dimensions of the ridge, you can also determine the relative density of the bone from the CBCT's rendering. And it's called using Hounsfield units. And the way you would do so is you would basically go to your tab that says Profile on it, click on that, go to your site, and basically draw a line that you want the profile to take. So let's just click this over a little bit. Good. All right, so I've just basically moved it over one slice, and the numbers are still there. I can always come back to it and you can still see the numbers, but I've just moved it over one slice. Now, in order to see the bone density, the relative bone density, and I want to qualify, when we talk about Hounsfield units, that's a relative bone density. In other words, it's unique to every machine at every location. In other words, a 200 Hounsfield unit will tell me something, but it'll tell me relative to the adjacent bone for that particular patient, but it's not an absolute value. It's not like you can take a CBCT from Europe, say 200 Hounsfield units, and say, oh, this is the quality of bone we're going to get. And then we're going to take the same thing in North America, 200 Hounsfield units, and say, yeah, that's the same density. You can't do that because it's relative and it's specific to every machine. There is an absolute not Hounsfield units, there's an absolute bone density measurement, and that's using the dental eye through the R2 gate system, but that's an entirely different system, and we're not going to talk about that. Just so you know that bone density, Hounsfield units can tell you a relative appreciation of the patient's bone density based on these numbers. So the way you would do it is you would click on the profile, click, let's say start off with the gingiva, and then just drag it to the destination, let's say the nerve. Okay? And so if you look at this image, basically you'll see that the bone density here is quite soft. It's actually in the minus 150, minus 400 zone, and that's the soft tissue here. And then we're going to start encountering the cortical plate, which is this part. Okay, as we keep penetrating it, you'll notice, sure, we start getting trabeculation, it starts getting soft again, and then somewhere in the middle, it gets quite dense. Okay, and that equates to this amount right here. So again, you can do a Hounsfield unit measurement. It'll give you a relative appreciation of the patient's bone density. Again, this is not an absolute measurement, but it's relative, and it gives you a good understanding or appreciation of what to expect when you do the surgery. This is especially important if you're planning on doing an immediate implant and you're wanting the implant to stick. If you want that implant to really bite and have initial stability, and you have a very low bone density or low Hounsfield units, you might want to think twice about that. Again, This is just additional information for you.